Well, I'm now joined by three expert guests to kind of weigh in on these NOAA new climate normals and kind of what the human impacts, the health impacts, economic impacts, and of course the climate impacts of what we're seeing with these warming trends. I'll start with Dr. Kalkstein. Since you're the climate scientist of the group, I want to start with you. What stood out to you when you're looking at NOAA's new climate normals?
Yeah, thank you, Brock. The strongest thing that stands out to me is the minimum temperature increases that we've seen as compared to the last 10 years. Now, remember, there's only 10 new years added. They leave off 10 years and they add 10 new years. But much like we've seen in all of our research right now, minimum temperatures are increasing at a fairly dramatic rate. Within just the worst air masses, they're increasing even more rapidly. That is the hottest, most dangerous air masses to people. Maximum temperatures are not changing much. In some places, they've actually gone down a little bit. What this means is that the overall diurnal range, or the difference between the high and the low temperatures, has been diminishing rather quickly if the high temperatures don't change much and the low temperatures are becoming warmer. So that's one thing to note, and that does have implications on human health because overnight relief during heat waves is something that's very, very important. So if you were to ask me for one important point, that would be it.
Yeah, and Dr. Aaron Bernstein, I want to bring you in here to talk because you mentioned health. Now that we've entered this new normal of warming weather and more precipitation, more heat, what are you thinking of? What sort of concerns you the most when we think about the impact that this could have on public health?
Boy, that's a really important question, Brock. I think what bothers me most is, given what we know, why aren't we moving faster in the direction we know we need to go? So, we have tremendous opportunity here, frankly, to do things that we ought to be doing without climate change to improve health. I mean, I think about the children I take care of and the problems they face: mental health, obesity, asthma. I can't fix those things very well with a prescription. But we can do is change how communities are designed. We can improve the systems that are in place to keep people safe from the extremes of climate change. We can reduce our reliance on fossil fuels, which makes air pollution that's driving all kinds of people, children, the elderly, to the emergency room. These are things that we would want to do already. And now with what climate change is showing us it does to health, we have even more reason to take these actions.
Yeah, and I want to bring in kathybaughman-mcleod here, who's our returning champion. Kathy, you were kind enough to join us last year to talk about extreme heat and the effect of extreme heat. And just listening to Dr. Kalkstein talk about that minimum temperature being raised, that really concerns me, right? You're thinking about not having that same kind of relief to the heat that we might have had before. When you're looking at this, thinking about it through the lens of extreme heat and our exposure to heat, what concerned you most about the report?
I think what concerns me the most is that extreme heat and heat is killing more Americans than any other climate-driven hazard, and that it's known as the silent killer. And the reason we're having a hard time solving it is that it's like a secret. It's quietly killing people, and we don't fully understand that. And the awareness isn't there, and it's not dramatic. It doesn't rip the roof off of your house. It doesn't, if you do an aerial photo of a community that's had a heat wave one day and you come back the next, it may not look much different, but yet you've had, more carnage and more long-term impacts, both health and economic. And we don't understand that. And to make those normal temperatures or average temperatures further exacerbates that lack of awareness by normalizing something that's not normal, and it's killing us.
Yeah, and we know that these health impacts, these heat impacts, they don't impact people equally. This is also a justice issue as well. So let's kind of open it up to the group. When you see something like this, when you see an update and you see this slow creep of warming that continues to become more and more of a problem, how do you think that will drive inequality across the country?
All right, I'll start off. One of the things I also want to see about the climate normals, which I don't think has been investigated, is the change in variation. And this will go to the social justice question as well. We're finding that it's not just warming itself that causes a problem. It's the differential between the worst and hottest days versus the rest of the normal climate, the average climate. If in fact those hottest days are becoming even hotter and becoming more extreme, especially the minimum temperatures from the rest of the pack, that's going to be the most dangerous thing. As far as I know, no one has investigated that yet with the new normals, but I think it should be one of the first things maybe our group should do, get a graduate student to do this, because it wouldn't be that difficult. What's happening too is that in the heart of the urban area, those normals are basically from airport locations. So in the heart of the urban area where most of the problem lies, where you have high density of population, the greatest poverty, poor housing, and so on, we're not learning enough about what's going on with that area when we're just looking at the airport data. And most of the normals that NOAA worries about represent the airport where you have the best climate data. So be assured that whatever you're seeing in these normals from the airport is being even exacerbated further in the inner city, where the relationships are even stronger, and of course, where most of the population lives that's vulnerable to the vagaries of heat.
One of the biggest drivers of temperature, and when you think about equity in neighborhoods, and as Larry said at the top, thinking about the way that we build the city, so the materials, the infrastructure we use, the pavements that are absorbing and then emitting heat, and reflective surfaces are much better. And so we've got a lot of structural issues, but one of the biggest challenges is that communities, low-income communities and communities of color, are most likely to live in communities without trees and tree canopy. And so one of the biggest solutions, and this meets Ari's point about health, is tree canopy is a multi-benefit solution. It's like trees are the superhero for climate adaptation. They are cleaning the air, cleaning the water, cooling the community. And sometimes the difference in the same city could be as much as 17 degrees Fahrenheit. I mean, it's just gobsmacking. And you also get lower bills in your utilities because you're drawing less energy. They store carbon. I mean, they're just endless. They can produce food. I mean, it's just wonderful. And so there is a concept from one of our close partners, the American Forests, called tree equity. And they've begun to look at cities and say, what's your tree equity score? And so urban greening is one of the best solutions to address historic inequality of all kinds. Not the only, but one of the strongest. And we're working toward financing those, because that's one of the biggest challenges, is the financing for them. So.
Yeah, Dr. Bernstein, I've really been taken listening to other interviews you've given where you talk about the role that we need from medical professionals to talk about climate change. We're obviously coming through this year where listening to medical professionals has been such a central part of our life. When you think about what would you like to see medical professionals do with information like this that we continue to get, which is just showing us that our world continues to warm and it continues to have these negative impacts?
Well, Brock, the decision that our center at Harvard has made, and that I've made personally around the climate issue, is that what we face is largely an issue related to will, not so much science. The science couldn't be clearer, and also the solutions are available, and we're not using them. And the reason is that, and this is to a point Kathy made, is that the risks of climate are always seen as one step too far away, and too, both in time and in space. So we need to make the climate issue much more personable, much more urgent, much more actionable. And to do that, it needs to be depoliticized, because right now in the United States, everyone hears the word climate and it's immediately a partisan concern, not a health concern. So the research shows us that if you talk about health, climate change moves from that far away in time and place issue to something that can sit on the kitchen table. And the last year with COVID made this so clear, right? So we saw that when something hits our concern in a way that's very personal, we change our behavior quite quickly. Now, also the pandemic showed us that the way that message is most influential is when it comes from someplace that's trusted, that's close to us. So in the advice around COVID, the data showed that it was the local public health professional, your primary care provider, the health person who was most connected to you in a trusted relationship mattered much more than people who are state officials or federal officials. So too with climate change. And so we recognize that most providers in the United States are actually already concerned about climate change. They see it largely as an issue for their personal lives as you know, members of society, less so as their professional responsibility. And yet, you know, with all of the disasters that have happened, including heat waves, which turn off power supplies, it's directly affecting the ability of providers in the United States to do our jobs. And so we're trying to highlight the connections that show the clinical relevance of climate change, bringing the issue to the bedside so that providers, when they understand that this is a job issue for them, are probably going to be much more likely to have that conversation about climate change because it is their professional, it is our professional responsibility. So that's how we got to that decision. And critically, we see when we see particularly the arguments laid out around climate actions that benefit health, what I was mentioning before, that when we rely less on fossil fuels, when we provide healthier urban landscapes that have less pavement and more green space, when we provide more healthy diets, these are things that are good for health anyways. They're motivating and they're climate solutions. And I think those messages given from the right place can be very powerful in getting us faster progress to address climate.
But let me drill down a little bit on that relevancy you're talking about, because obviously if we're burning fossil fuels, this leads to an extraordinary amount of disease that comes from air pollution, right? We're breathing in the kind of crap that comes from the burning of those fossil fuels. But you've had some really, I've heard you talk about some of the ways in which climate change can have unexpected impacts on our health. You know, how does climate change lead to more disease or more sort of negative health impacts?
Yeah, well, let me pick up on the first point you raised, Brock. So a study out of the Harvard Chan School and Glasgow University just this past month found that in the United States, some 300 or 350,000 Americans are dying before their right time because of the air pollution generated from burning fossil fuels, which is staggering because that's more than half the COVID mortality every year in this country. Can you imagine? I mean, think about how much we've been through with this pandemic, but we're actually having that almost every year with air pollution from burning fossil fuels. Globally, the study found that 1 in 5 people are dying prematurely from fossil fuel use, right? That's staggering. So we should not underscore that. And to the point of equity, air pollution is not an equal opportunity killer. The same way that heat disproportionately affects low-income households, particularly Black Americans and Hispanic Americans in the United States, so too with air pollution. Now, to the question you raised around the broader issue of climate change and health, you know, I think what we have to grapple with in the realm of climate change and health is that anything that you are interested in from a health perspective, whether that's your heart, your lungs, your kidneys, your brains, your risk of cancer, you name it, climate change matters, okay? And you know, I have a whole course online that can walk anybody who wants to see it, the public health effects of climate change. We've had 120,000+ people take it from over 100 countries, so it's well vetted at this point. But I think that to me is the departure point, because it doesn't help us to talk about how bad it is, and it's plenty bad. What I think is critical is that we focus on the solutions at hand and understand what those mean to health. And heat is a really good one. Kathy alluded to the nature-based solutions for heat, which heavily emphasize urban greening, you know, can dramatically reverse the risk of heat in cities. And a critical point here is that for most cities, the warming is not because of the greenhouse gases, although that's a part of it. It's because we've built cities to be ovens. And those ovens cook the people in those cities who can least afford to be cooked. So, you know, we have a tremendous opportunity to right inequities, to promote health. And by the way, you know, not that urban forests are going to reverse our carbon budget, but they certainly aren't going to hurt, can actually confer dividends. So I think the starting point is, yes, we acknowledge that climate change is one of the biggest health challenges we face. It stands to make the inequities we're trying to deal with far worse, but the solution space gives us immense opportunities to tackle the health problems we're facing right now in ways that are really hard for individual providers like me to do anything about, and promote equity at the same time.
Yeah, Kathy, I want to talk about some of those solutions because obviously we're now in this period of rebuilding and even like reimagining what we can do with our cities. Actually, it's one of the things that gets me most optimistic when I think about how we can fight the climate crisis. We really do have an opportunity to kind of rebuild in a more sustainable way. You talked about the greening of urban spaces, but what else would you like to see cities, countries, local areas do as they're starting to build up more infrastructure post-COVID in a way to make their economy more sustainable and more adaptive to extreme heat?
There are myriad solutions, as Ari said, and there are lots of evidence base behind it. So when we talked a year ago, we had just launched the Extreme Heat Resilience Alliance. And so the work of the Alliance began immediately and in 4 categories: education of decision makers linked to vulnerable people, in policy, in risk and finance, and in the implementation of these projects and things that reduce impacts and risks of heat. In those four categories, we have collected all sorts of evidence of what works. And when you think about the opportunity in the US of the big infrastructure package, it does provide immense opportunity. And you've seen discussions of a climate core or a tree core or a new CCC that would put people to work on infrastructure that's climate smart and resilient and both low and no carbon and good for reducing the temperature and protecting coastlines, lots of nature-based solutions in there. But just to give you a couple of examples of good what we can do, lighter surfaces are great. So some of that is retrofitting. You can resurface what we've got that is currently absorbing and then emitting heat to be more reflective. You can change the policy so that folks that are working outside and in hot warehouses where, we're all having everything delivered these days. And so folks are working in air conditioned warehouses. And so they're exposed to heat in that way, or people that are helping pick fruits and vegetables, construction workers, et cetera, hours for them to work at different times. We have seen even the technology of cooling vests. So will we need to wear something that keeps us cool so we can keep going? I mean, there are questions about at which temperature the fruit or the vegetable no longer grows there. So there's a bigger picture here, but just in terms of protecting people. And then thinking about emergency actions that happen before a crisis. And in the topic of disaster risk response, oftentimes we're sending philanthropy in afterward. And there's an increasing push to do this beforehand. And there's a body of work that the Red Cross Climate Center has advanced called forecast-based financing. And that would mean on a wonderful forecast that Larry and his colleagues would provide, that would trigger funding that would drop into a community's treasury to quickly go out and go door to door to find people living alone in unair conditioned apartments, to requisition cooling centers and generators that allow to keep people cool. Also, a lot of communities have already done immense work around this and prevented the utility, the local utility, from cutting off the power to people who are in non-payment or have not paid their bill and are at risk. And so part of the stack of crises we're facing are that people, after the economic impacts of COVID, they're choosing between medications, because pre-existing conditions have a lot to do with your vulnerability to heat.
Right.
So you're going to pay for your medicine, you're going to pay your utility bill, are you going to pay for food? And so the idea that you don't cut power at a time when this is happening. And so we have developed in the Alliance a policy toolkit, a list of all of the interventions that reduce heat, and then the financing and risk mechanisms that go with that. And then we're looking at, and I hope we're going to talk about today, we believe that ranking and naming heat waves is one of the best retail ways to bring the attention to this, to build that culture of preparation and awareness.
Yeah, let's talk about Dr. Kalkstein. I want to bring you in and talk about
Yeah,
that
you know what,
preparation.
Brock, before you ask me a question, let me amplify on what Kathy said, because the work I'm doing with EHRA is very rewarding, and I'm really enjoying the ranking and naming work. But most of my research involves cool city solutions. That is, that we presently have the technology today to cool the cities by 2 to 3 degrees. And of course, heat waves are not going to disappear. But what that would do is it would lower us below the threshold where many people are going to get sick and die. There is a threshold for everyone. And if you can lower the temperature 2 to 3 degrees, if the high instead of being 100 is 97, they'll still be uncomfortable, but they'll survive. And what I'm doing now, which I think is very important, and I really enjoy the work, is I'm working with private enterprise, particularly 3M. 3M, besides making Post-it notes, makes small granules that go into the roofs of houses. These granules are highly reflective. They increase the reflectivity of the roof 4 times. So the average roof has a 7 to 10% reflectance. Imagine increasing it to 32%. 2 things happen then. Less energy goes into the house, you need less air conditioning, and more energy gets reflected back to space, which means less absorbs in the Earth's surface, which makes the surface cooler. We've been modeling the city, assuming that, let's say, half the houses had these materials. And quite honestly, we could reduce heat-related mortality by 20 to 30%, which is sizable because the average number of heat-related deaths in a year is about 1,500, highly variable from a low number to up to 7,000 or 8,000 on some years. Also, we're working with the Forest Service, doing some of the stuff that Kathy is talking about. What if we increased urban vegetation canopy by a large amount? And we're working through the Los Angeles Urban Cooling Collaborative, which I've really enjoyed, by both adding reflective roofs and developing scenarios with more tree canopy, and you're saving even more lives. So this kind of research is important. It will not stop the problem of climate change, but it will cool the city and lessen the number of heat-related deaths. And the most important thing is the technology is here today. By the way, 3M now makes pollution-absorbing granules, amazingly enough, that absorb nitrous oxides from the atmosphere. We're working in San Antonio with 3M right now, and the roof absorbs the nitrogen oxides, and then when it rains, it just washes off the roof and fertilizes the ground around the house, but it absorbs and reduces the nitrous oxides. Lawrence Berkeley National Lab said that it can reduce ozone by 10% in some areas because nitrous oxides turn into ozone. I want to make one more point, and I hope I don't blindside my colleagues with this, but because they've never heard me say this before. I live on Marco Island, Florida. It's a rather conservative place. Most of the people here are Republican. Most of the people here are climate change deniers. They're wonderful people. They're not racist. They're nice people, but they're not the people I deal with in my life's work. Kathy and Ari don't even know this. I'm asked by civic groups to talk about climate change all the time. And of course, when I started, I'm an advocate. Obviously, I'm worried about climate change. I was on the IPCC. I've been doing all this work. I was not being received well. Now, the goal isn't to just be received well when you give a presentation. You've got to get the message through. But I think and I feel that many of the people here who are all over the country, as we well know, in many rural parts of the country, in red America, many of the people are very skeptical of climate change. So how do we, as climate scientists, medical experts, and so on, handle this very large, almost half the population of the country that feels this way? I've learned that hammering them in the head is not the way to go to this. So when I talk about climate and health now, I always say to them, I don't care what your impression is about climate change. The climate is changing. You want to accept that or you don't want to accept that, that's up to you. Heat is already the leading weather-related killer in the United States. Whether you believe in climate change or whether you don't, that's a fact. We've got to conquer this particular problem. How do you do it? And when the discussion goes away from just talking about climate change and dealing with this problem, I find that whenever I give a presentation, it is better received. The people are more enthusiastic about action, which is the most important thing you need, especially in a red state. And I just find that this approach, from my standpoint, is the best way to do it. Now, I'm more than happy, since Kathy and Ari had no idea I was going to say this, I am more than happy to have them either refute or say what they'd like about it. But that has been my impression about this in my many talks, living in really red America, which is where I am. So sorry I blindsided you guys, but I don't know if you have any comment, and please don't hesitate to dispute what I said.
Well, I've heard Dr. Bernstein talk about meeting people where they are. This is a physician will meet someone where they are so that they can change or sort of adapt their behaviors. And I'm curious, when you think about, let's talk about heat in particular. There's obviously people who are living in areas that are very hot, and they're getting increasingly hotter. So you can talk about, how do you communicate some of those health dangers that we're experiencing when we're exposed to heat, constantly, and those minimum temperatures are going up?
So look, Brock, I've lost all my hair already, and you can't see that, but you'll just have to take me on faith there. So, what do I spend my days doing? I spend my days trying to frankly convince people to do things that for whatever reason they're not going to do or have an inclination doing. A lot of the challenges I face are not the kind of challenges in which people don't want to change. It's that they're unable to because of things that are making it really hard. Like obesity is a great example, right? Nobody really wants to be obese. I mean, we're not in a society that says, boy, is it great to have someone who's, heavily overweight. It's they lack access to essentially what we can do to maintain a healthy body weight. So there's a lot of that in the climate issue. There's a lot of folks who would do, as Larry points out, who would be doing stuff if there weren't roadblocks in our way. And so we got a lot of work to do there, whether that's in decarbonizing healthcare. So there's a big push to get carbon out of healthcare. Well, I don't think most hospitals are wanting to, cause harm. And so what we need to do is figure out what the obstacles are to get faster. Now there's a different group, and I think this is also what Larry was saying, that, don't want vaccines. and no amount of science is going to change that, right? So how do you deal with that? And to your point, Brock, heat, in Boston in February, if you talk about it being warmer, people are like, yeah, let's get some of that. So the understanding of heat from a Bostonian standpoint is it's a good thing. And I think the critical piece that we've gotten behind the 8 ball on, and that we need to really get ahead of, is, to your point, is we need to understand where people are at. I mean, Larry sounds like he went through the gauntlet in his community and understanding where his community is at. And I think we assume that people understand where we're coming from and that we understand where they're coming from. And, people like me, we tend to get frustrated with people who don't vaccinate their children because we see the children dying in our hospital from vaccine preventable diseases. And we know from science that the vaccines are safe. And so we presume that that's going to register, but it doesn't. So with heat, coming forward on heat from a perspective of, as Kathy alluded to, this is already our most dangerous natural disaster. Shouldn't we be doing something about this? Well, people right now can't afford food. And saying, let's worry about the heat seems like kind of a rich person's problem. So how do we make heat relevant in the context of not having food, or not being able to pay your bill, or not having a job, or having yourself displaced, or worrying about even potentially completely irrational fears? The number one reason for gun ownership in the United States is people are afraid that, someone's going to come, particularly the government, with a gun into their household. So we have to embrace the fullness of communities' understandings, whether we agree or disagree, and find a path forward. Now on heat, I think, some of the solutions offer that, right? There are communities that actually do not want green space. In fact, there have been many mistakes made where people just say, oh, green space is good, let's put some trees down in this community. And the community is like, that's not a good way to go. But in contrast to that, look at what just happened in my hometown of Boston. In the 70s, actually, and predating that, there were moves across the country to build freeways through Black and brown communities, right? And that chopped totally divided communities. Now in Boston, there was a protest against that, and the highway was stopped. And there's actually an annual celebration of the community uprising against this in my part of Boston every year to celebrate this community activism. But the community was still destroyed. Move forward 20 years from that, the city made a greenway in a heat island that, the trees are now mature, and there was a plan to chop down those trees. Not joking, chop down those trees. And you know what? The community wasn't so happy about that. And this, there's this narrow strip of green space in this largely green devoid area. The community's motivation wasn't about health primarily. It was about the historical injustice. It was, you are stomping on an already inequitable situation. And so finding those levers, meeting people where they're at, can we find a way to talk about heat in ways that people will get? And maybe that's through utility bills. I mean,
right.
People, we know that the poorest Americans pay the greatest percentage of their bill income on utility bills, and the largest utility bills are in the South where Larry lives. And boy, putting in green space really saves money. And oh, by the way, it'll make your air pollutions better, so your pregnancy will come out better. Your senior citizen population is not going to have a stroke and be disabled for the last 8 years of their life. And oh, by the ways. So we have to really focus on understanding what the needs and wants are of communities. And the thing with climate change is, as I mentioned to you before, is it really doesn't matter what part of health you care about. Climate will connect to it. So let's start with where people are at. Utility bills in the South are the highest in the country. They're most burdensome on poor communities. Let's fix that. Well, we can air condition the world, but air conditioning turns out doesn't save people when they can't afford to run it. Or they're choosing between running the air conditioner and going out to dinner. I mean, these are the kind of choices people make. So, this is what I talk about. And frankly, the public health community, I'd like to say as a group, would like to endorse the idea that we start from where people are at to try and figure out how we can get the science that shows us where we need to go put into action.
Ari, that was put so well. I've got to tell you, I fully agree with everything you said right there. And it does apply very much to my community. So thank you for expressing it that way. I really enjoyed what you just said. So.
Oh, Kathy, you're mute.
Classic. Larry, I don't dispute what you said. I think, we're at the Adrienne Arsht-Rockefeller Foundation Resilience Center. We reflect the values of the Rockefeller Foundation, and we're focused on the most vulnerable people. And those people, don't have the luxury to deny the science and aren't really thinking about that. And that is, that's a political problem, definitely. It may maybe block some good policy that protects people and provides more, quicker avenues to healthy communities. But if you look around the world, the US is really the only place, and we work globally and our partners are global, the only place that's really spending time talking about why climate isn't real is in the US. And so it's just an inevitability of the science, of the impacts of the way companies, whether they're talking about it or not, are shifting capital investment to places that are cooler, moving operations north, changing their fleets. There's the inevitability to the regulation and the mandatory disclosure of climate risk of companies. And so it's going that way. And so for us, that's less of an hindrance. And I think meeting people where they are 100%, and we have the same notion. And I wanted to make a couple of points. And Ari, you hit on this. The last thing you said, one, just basic, heat is a stress and a shock. So it's slowly happening and the diurnal ranges are shrinking, but also big Mac Daddy, Mama Jamma heat waves that come and people aren't ready for them. And so that's when lives are lost and such. And so I just want to point it out, it's both. You think about the impacts of climate change, sea level rise is a stress, hurricanes are a shock. And so that may be wonky and, less relevant for the audience today, but I still think it's important because you have to deal with both and be ready for both, resilient to both. But the key
You're talking to a very wonky crowd, by the way.
Oh, good. Okay. I guess so, right? If you're going to come on and listen to an hour of climate talk, you're ready for this. So let's get down into it. I want to talk about heat risk and heat risk informed decision making. And in this big infrastructure package that is being discussed at the federal level here in the US, heat risk informed decisions need to be made. Big billions and billions of dollars being invested in things that are not considering heat risk, not a good idea. That's one. And two, communities making decisions, just as Ari was saying, you have to know who's most vulnerable. Where are they? What is the risk? How big is it? What's the health risk? What's the economic risk? How do I ameliorate the risk? How do I transfer the risk? And so there's a dearth of accessible heat risk modeling for people trying to make decisions about heat. And I think that's changing. And there are increasingly open source tools to let communities measure that risk. But one of the first things that you can do is understand what the risk is. And that's in large part what the mission of the Extreme Heat Resilience Alliance is to bring awareness, but also discrete measurement of the risk with existing catastrophic risk modeling tools and others and other types of tools. There are tools now that are assessing climate risk based on IPCC predictions and projecting loss, not based on the past, but on the future. And so lots to say around risk modeling, but I think risk quantification is really important and to make it easy for people and accessible. And that's one of the things we're working on at the center and with EHRA.
Yeah, and I'm curious, now that, we talked about this last year, you're naming extreme heat waves and that community, how do you find hooks to get people interested and engaged in communicating and learning more about heat? So what have you learned in the last year around communication that you think is really useful?
We have learned that you need a trigger for people to change their behavior. And we're working with a behavioral economists to understand what is that trigger. And so the hypothesis is that the naming of the heat wave is that trigger because the media takes it up, you have the hashtag, and people change. When they hear it, they know what to do. And I said this to you a year ago, I lived in Florida for 25 plus years. I know what a Category 3 storm is in terms of a hurricane, and I know what to do to prepare for it. And so the name has that benefit. The other piece is that people who are vulnerable don't necessarily think they're vulnerable. And even if the messaging does reach them, that doesn't mean they do something about it. And so there are some challenges in segmenting groups in terms of getting people to change behavior, understanding their specific situation. The other thing is that the community is everything. So we talk about scaling, and lots of global organizations talk about scaling and replication. Everything stops and starts in the community. And if you don't have the stakeholders at the table and you don't have an awareness and an understanding and a socialized, ready to go plan, no amount of money will make a difference if the community is not ready and not informed and behind it. And so those are the learnings of the last year. And also then understanding, I found some sticky spots in the science community and in the public health community and in the governance, public administration and the people that run cities and counties. And you understand people get in their silos, and that's for a reason. And it's essential we come out of them for this, or we can't solve it.
Yeah, Dr. Bernstein, one of the other things that I think a lot of people pay attention to is the impact these things have on children's health. When we think about the impact of heat, because everyone thinks of children as being the most vulnerable. And obviously you're a pediatrician, you think about this a lot. So what do you want to communicate to people when they think about the impact this could be having on their own children?
Well, I think the biggest thing, what I hear most often is that it's too hot to be outside. So public health problem number one for children is the obesity epidemic, right? So for the first time, and this predates the opioid problem and disaster, calling it a problem is an understatement. And then of course, COVID, the life expectancy of American children was going down because of obesity. which, you know, for folks who are interested in public health, that's a huge shot over the bow, right? So life expectancy has been increasing in the United States since the beginning, with the exception of the flu pandemic. And obesity is not an infection, it's a chronic disease. So it's not like it comes and goes. So obesity, about diet and exercise. Well, diet is a whole suite of actions, and there's a whole suite of solutions that we have that we need to do more with. But being outside is critical. And if it's too hot, you're not going to go outside. And you know what? Obesity, one of the risk factors that comes with obesity is asthma. And when it's hot out, there's more air pollution. So there's a double reason that children who are obese are not going to be going outside and exercising. So to me, the way that we work on that issue is to really focus on, if we're talking about in a conversation with the parents, like, okay, you know, we need to be mindful of the heat because, you know, your child may have asthma or heat's just a risk. I mean, children athletes are a major risk group for heat exposure, right? So Texas learned this the hard way, but the good news is today they've done a lot to keep adolescents safe, but not, and, you know, a lot of states are seeing more heat, and we don't have necessarily the pieces in place to make athletics safe for children. But let's make sure that our providers understand the risks. Let's make sure the parents understand the risks. And let's do the first reasonable steps, which involve being aware of the heat risks, as Kathy was talking about. We need much better communication that is targeted to the people who need to hear it in ways they can understand in simple communicated ways. But let's also not neglect the reality, which is most of the heat problem in cities is because of how we've built them right now. And most of the air pollution problem that gets worse with heat is coming because we're burning fossil fuels, and that I cannot in a clinic visit do much about those problems, which is why it's critical that we deal with them as communities, as towns, as states, and as a country.
Yeah, no, Dr. Kalkstein, obviously heat waves and those extreme heats, that's the kind of stuff that makes headlines, right? It is, you know, unfortunately, it is a thing that will make people pay more attention to something like these sort of steady trends of global warming. But I'm curious, you know, in it, I'm always nervous to talk to climate scientists and getting something wrong, but like when we see these new normals and when we see these areas that are getting hotter, is that going, do you think that is going to lead to more extreme heat events in the next decade?
Oh, absolutely. There's no doubt about it. It will. And this is why I think our heat wave ranking project is so important. And I'm really proud to be part of this. And my group has been charged with the science behind developing the system that the ranking will be based on. And we're honored to be in that position. Let me just tell you this, what makes heat wave ranking different than any other weather event that you're going to rank, like hurricanes, tornadoes, blizzards, all of these, is that it is the only one that's not going to be based strictly on the meteorology. The heat wave ranking is going to be based on the impacts of the heat, rather than whether it's 100 degrees, you make your borderline at 100 and 105 and 110, which is what is often done. And I really love the fact that we are going to be unique in that way, because our ranking system is going to be based on negative health outcomes. We don't know how many rankings they're going to be, but a level 1, for example, would be the lowest kind of heat wave where, for example, you're not going to have much in terms of death and morbidity. A level 2 will be a higher level. We haven't even made these levels yet. But that's the beauty of it. And the same heat, one of the things that's interesting that people don't know is the same heat early in the summer season is much more damaging to health than it is late in the summer season. So a heat wave in June will kill and maim more people than they would late in the summer season when people are used to the heat. We've already removed some of the vulnerable population because they died in the early heat waves. I don't want the ranking to be based on the temperatures, humidity. I want it based on the outcome. I don't care if people are uncomfortable. We don't want them to get sick and die. That's the most important thing. So we're working now on this ranking system, and we're going to do it locally. The National Weather Service usually has a national criteria. They just put out a new map, which shows where the temperature criteria exceed a certain temperature. It's light green, and then yellow, and then red. Personally, I like going to the urban area itself because Kansas City, Detroit, New Orleans, Duluth, they're all going to react differently, not only because the climate is different, but because the demography is different. The urban structure is different. So we are going to correlate the heat waves themselves directly with the response from the death data. And we have everyone who has died, data on them from 1975 to the present. So we have a huge and rich base. Now, once we do the ranking system and the naming system, there's more that has to be done. If you just say there's a level 3 heat wave, as Kathy said, that's not going to do much good. The urban area has to have a coalition of people to work together on intervention, stakeholder knowledge, and the public's knowledge of how bad this could be. So any ranking system is only part of it, and you need to have the stakeholders and the city and the urban area involved as a coalition. How's the health department going to react? How's the fire department going to be reacting? Are they going to open more emergency rooms or put more emergency room staff out there? All of that is important. So yes, more heat waves, without a doubt. There will be more heat waves. And we need this ranking system, in my mind, specifically because of that. I know I wandered from your question a bit, but nevertheless, I thought it was important to mention.
Absolutely. Kathy, how would you like to see those coalitions build on that knowledge for a greater action?
Well, and I think it's happening. I think it's happening right now. There's a movement that predates the Extreme Heat Resilience Alliance in Los Angeles, and Larry was a part of that, and great analysis of understanding who is at risk and where they are and what the temperature is that they're facing. Sensors have been placed inside homes in a community project in Miami-Dade County and in other places. There's a scientist, his name is Brian Stone at the University of Georgia, Athens, with a methodology of assessing heat risk in at-risk communities and then prescribing urban forest for specifically that community to reduce the temperature and reduce the mortality and morbidity rates. So there's potential for scaling these types of interventions. So great work has been done in communities, but we need political leadership. We need policy that supports it and makes it easy. You need money to be able to bring that risk quantification and education. We need that mass communication style, which is the ranking and the naming. And one thing that has been just announced in the last 2 weeks is the first chief heat officer for a big urban community. And Mayor Daniela Levine Cava of Miami-Dade County announced the first chief heat officer. Her name is Jane Gilbert, and that role is focused on accelerating, expanding, and coordinating heat work to address the risks and impacts of heat in the most vulnerable communities. And so we helped to put that together with the county, but also with the mayor of Freetown, Sierra Leone, and the mayor of Athens, Greece. And Greece is facing immense heat risk, particularly Athens. And so that's a way to coalesce a community's efforts around a chief heat officer and to have somebody that wakes up every day thinking about it. And then liaising between the national level and the local level, and right down to the community, to the neighborhoods who are suffering the most. And there's one point that I wanted to make that relates to what Ari said, and that is, I read it, you just did a podcast, maybe your last week, talked about the neoliberalism around climate and the approach that we've taken to try to address climate change, some of the big mistakes that we're making. And the idea of that we know, I mean, you have to have some humility here. It's where I'm looking at, you all are not looking, you're listening, but Larry and Ari and my skin, we're white. And it's really important that we don't think we know a community and that we don't think that we know what a community needs. And so we can see the science, we can see the solutions that have worked in other places. Ari made a fantastic point that not all trees are welcome. And in some communities, parks are dangerous places where bad things happen to people. And so we have to be partners to communities. And so when you think about heat, it may not be that a community even thinks that heat is their issue. And we do work in Chennai, India, and we met with a group of women in a settlement where they had been moved from one place to the other against their will, essentially, because their slum had been washed out in a flood, and they had poor access to fruits and vegetables. They had to carry water up 8 flights of stairs because the elevator was broken. And heat is one of the biggest drivers of the crises they face, and it never crossed anybody's lips in the discussion about what the challenges are. And it can't matter to us. It can't matter. We as we've said, you have to meet people where they are. And so a chief heat officer is a great step at a local level or at a federal level to think about how do we put all these pieces together and coordinate the fantastic work that's happening now and accelerate it. Got to put some renewable energy into it and make it go.
Absolutely. And just to wrap up here, this is sorry, I became unplugged. Just to wrap up here, this is an extraordinary year. We've obviously people are starting to get vaccinated, and COVID is still raging around the world, but there's so much that we've learned through this pandemic. We've obviously talked about the kind of rebuilding and reimagining that is possible. And of course, at the end of the year, we have COP26 coming up, when global leaders are going to make massively important decisions on how our new climate normals are going to be for decades to come, what kind of extreme heat we are potentially going to be living under, and what we can prevent. So I'm curious, just to open it up to the group as we wrap up, what are you hoping to see this year most? What would be the most optimistic outcomes we could see, and what is possible in the rest of the year?
Are you talking about in general, or are you talking about in the area of heat? I'm not.
Either one.
Well, I don't want to talk about the generality of the world and its condition, but clearly I do think we're on the right track when it comes to heat and health. I think that awareness is going up. I think cities are putting more resources into this. I'm very excited about ranking. I'm excited that the National Weather Service, I have friends at the National Weather Service who want to work with us, meteorologists in charge of National Weather Service offices. And I'm looking at this year as a kind of a banner year to move ahead on heat awareness and wellness with people like Ari and Kathy working with me. I'm just like so excited about the group that we have. And I think this is going to be a very important year for us as we start our pilot studies on just this kind of thing, ranking heat waves, naming heat waves, and making them a more knowledgeable source of information to stakeholders and people.
I would echo Larry's excitement for the work, and to your point, Brock, COVID is hopefully a once in a lifetime event that we will never see again. Pandemics can reveal to us in the most painful ways what we need to fix. And I think one of the signs from optimism is that we see both in the United States and around the world some really fundamental reevaluations of what's important and what we need to do, whether that's equity, climate, how we think about economic development. These are conversations that weren't happening before this disaster sort of threw these issues into our face and rubbed our faces in them and made us all sort of take a step back. And so as we potentially have the largest investment in the United States in infrastructure since the post-war era, there's the prospect that those funds are not simply going to be spent in the same potentially misguided ways as they were historically, that creates injustice, creates urban heat islands, creates climate change, that those investments actually promote equity, that they promote resilience, that they lead to greater resilience to heat, because as Larry made abundantly clear, whether we won't like it or not, it's coming and we can see it coming. So the other thing that I think is critical is that we're not making the mistake of being siloed. We're thinking in intersectional ways. We recognize that heat, yes, it's about the immediate mortality risk, but it's a gender issue. It's an equity issue. It's an economic opportunity issue, right? So Kathy alluded to this work showing how heat affects our ability to be productive. And that, of course, has. So, when we are coming into a solution space with our minds focused on optimizing solutions so that we create the most amount of benefit, I'm really excited that we can do things that are actually, far wiser and better for folks. And the work around EHRA and the extreme heat resilience is, I think, an example of that. And I think it's an idea that stands to really do well in this atmosphere of thinking intersectionally and forward facing.
I'm inspired. I am hopeful because the voices of women and people of color are stronger, bigger, more visible in places of influence and decision-making and power than ever before. And the things that we used to consider externalities and the way we valued things are becoming internalities. And the impacts on health and our environment, we understand now the impacts. I mean, we'll take some time to fully understand and value in our financial system the value of nature and thinking of biodiversity and how it protects and supports us, our human life. And you can see that the bar for the social license to operate for governments and companies is being raised. And that means companies and governments have to respond to stakeholders, to protests, to communities saying, no, it's not good enough. And it's fantastic. And it's really, really inspiring. And it makes me think that we might get there. Yeah.
It makes me think we might get there as well. And thank you so much for this conversation. Anytime we can kind of have a cross-disciplinary conversation on climate change, especially around, new climate normals and the kind of heat we're facing, I'm extremely grateful for. So Larry Kalkstein, Kathybaughman-mcleod, and Adrienne Bernstein, thank you again for joining the Climate Pod.
Our pleasure, Brock. Thank you for inviting us.
Lots of fun. Thank you.